Low libido is more common than many people realize, but it's often surrounded by silence, embarrassment, or misunderstanding. Whether it's a temporary dip or a long-standing issue, changes in sexual desire can affect confidence, intimacy, and relationship satisfaction. The good news, you're not alone. It's okay to talk about it, and solutions do exist. Today, I'll break down the common causes of low libido and offer guidance on how to have open, non blaming conversations with your partner that nourish connection. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence based approaches, a sympathetic ear, and zero judgment. So let's start by answering the question of what is a low libido? Libido refers to a person's overall sexual drive or desire for sexual activity. It's influenced by biological, psychological, and social factors, and it naturally fluctuates throughout life. When libido drops and starts to cause distress or impact relationships, it may be time to take a closer look. Now, let's talk about some of the common causes of low libido. Number one is hormonal changes. Hormones play a key role in regulating sexual desires. There may be changes due to menopause, where there's decreased estrogen and testosterone that can reduce libido in women. Andropause, which in men leads to decline in testosterone levels with age, can also impact sex drive. Birth control or hormone therapies can alter libido in both positive and negative ways. Number two is stress and mental health. High stress, anxiety, and depression can drain energy and diminish interest in sex. Mental health issues affects the brain's chemistry, mood, and ability to experience pleasure. Number three is relationship issues. Emotional disconnection, unresolved conflict, resentment, or poor communication can lead to a decline in sexual interest. In long term relationships, sexual routines may also become stale or feel like a chore. Number four is medication side effects. Many medications can affect libido, including antidepressants, especially SSRIs, blood pressure medications, hormonal treatments, and anti anxiety and sleep medications. If you suspect your medication is impacting your sex drive, talk to your healthcare provider before stopping or changing anything. Number five is physical health issues. Chronic illnesses like diabetes, heart disease, obesity, or chronic pain can lower energy and libido. Fatigue and discomfort understandably affect sexual interest. Number six is poor body image or low self esteem. If you don't feel good about your body, you might avoid intimacy altogether. Self consciousness or shame around appearance can create a mental barrier to desire. Number seven is lifestyle factors. So, lack of sleep, poor diet, sedentary habits, smoking, and excessive alcohol use can all reduce libido. These factors affect energy levels, mood, and hormonal health. Now, let's talk about when low libido is normal. It's important to normalize that sexual desire isn't static. Everyone goes through phases of high and low libido, especially during life transitions like after childbirth, during grief or loss, under intense work stress, or while adjusting to major health changes. It only becomes a problem if it's causing you distress or harming your relationship. Now let's get into how to talk to your partner about low libido. This might be the hardest part, but also the most important. Many couples struggle with mismatched libidos, and if left unspoken, it can lead to shame, rejection, or even relationship breakdown. Open communication helps to build trust, intimacy, and problem solving as a team. Here are some tips to help guide the conversation. Number one is to choose the right time and setting. Don't start the conversation in the middle of a sexual encounter or right after an argument. Pick a calm, private moment when you both feel safe and connected. Number two is to start with reassurance. Let your partner know that this isn't about blame or rejection. Make it clear that you care about them and your relationship. For example, I love you and I want us to feel close. I've just noticed my sex drive hasn't been what it used to be, and I want to talk about it with you so we can figure it out together. Number three is to use I statements. Focus on your experience rather than criticizing or accusing your partner. This keeps the conversation open rather than defensive. So I want you to compare these two statements. What I want you to do is a statement like this: I've been feeling off lately and haven't been in the mood like I used to. What I don't want you to do is a statement like this: You always want sex and it's too much. I hope you can see the differences between these two statements. Number four is to be honest but gentle. You don't have to go into every detail right away, but honesty leads to understanding. If the issue is stress, medication, or body image, share it to the extent that you're comfortable. For example, I've been really stressed out and I think it's affecting my desire. It's not about you, it's something I'm trying to understand. Number five is to invite them into the process. Let your partner know you want to work through it with them. This shifts the dynamic from me versus you to us versus the issue. For example, would you be open to exploring this together? Maybe talking to a therapist or trying some new ways of connecting? Number six is to set shared goals for intimacy. Sex isn't the only form of intimacy. You can talk about what kind of physical or emotional closeness feels good to both of you during this time. Maybe it's more cuddling. Maybe it's non sexual touch. Or maybe it's taking pressure off intercourse for a while and rediscovering other forms of closeness. Let's get into when to seek help. Sometimes outside support makes all the difference. You may want to consider talking to a doctor to rule out medical causes or adjust medications. You may want to talk to a therapist or sex therapist to explore emotional and relationship dynamics. You may consider a couples therapist to improve communication and intimacy. Low libido doesn't mean you're broken or that your relationship is doomed. With care, curiosity, and compassion, it's something that can be addressed. Here are some practical steps that you can take in addition to talking to your partner and seeking help. The first is to get enough sleep. Fatigue is a major libido killer. You want to exercise regularly because it boosts mood, confidence, and energy. Eat a balanced diet. Nutrients like zinc, magnesium, and omega 3s support hormonal health. Cut back on alcohol and cigarettes. Both can interfere with sexual function. You also want to manage stress. Mindfulness, journaling, and therapy can all help. It may sound unromantic, but carving out time for connection can reignite desire. Low libido is nothing to be ashamed of. It's a human experience shaped by biology, emotions, relationships, and life events. Instead of staying silent or letting resentment build, start a conversation. With empathy and teamwork, it's possible to navigate these changes and come out stronger on the other side. Your sex life is not just about frequency or performance, it's about connection, pleasure, and mutual understanding. And that starts with a courageous, kind conversation. What other sex and relationship topics would you like for me to cover? Let me know. You can contact me via Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg with script editing by Brandon Getchus. Our podcast and advertising operations specialist is Morgan Christensen. Our digital operations specialist is Holly Hutchings. And our marketing and publicity associate is Davina Tomlin. Nathaniel Hoops is our marketing contractor. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.